Hi, I'm Naomi from the Academy of Fitness. I'm now going to deliver a 30-minute exercise program for an older client with a managed condition. Our client today has previously had surgery on his knee. He's just completed 12 months of physiotherapy, and our program is designed to assist in getting our client back to running again. Our client has already filled out an exercise pre-screening tool. We've also filled out the client profile form for him. He has a referral letter from his physiotherapist, and we have the exercise program for you. Okay, Harold, what we're going to do is our warm-up. We're doing it on the stationary bike because it'll be the least amount of impact on that knee. Because of the injury though, we are going to warm you up for 10 to 15 minutes. So I'll get you to start cycling for me, please. As you're cycling, I'd like you to push through your heels. Try and remember to brace through your abdomen as much as possible. Relax your shoulders, squeeze through the scapula. Should be nice and comfortable right about now. Now, are you experiencing any pain in your knee?
No.
Excellent. And nothing in your lower back or your shoulders?
No.
Fantastic. What I'll get you to do is just cycle a little bit faster for me. And I'm just going to add a little bit of resistance. Can you feel that resistance? Yeah. Okay. Just to start increasing, I'll drop it back a tiny bit. Just to start increasing your heart rate. The purpose of a warm-up is to increase your heart rate up until we get to your exercise heart rate. We don't want you to have your heart rate too low when we actually begin your exercise, because then you're not appropriately warmed up. So we'll be here for about 10 minutes, so I'll keep increasing that resistance for you. So just let me know if it gets too hard.
No, that's all right.
Excellent. Okay, Harold, the first exercise we'll be doing is a wall push-up. So we'll have our hands at about chest height, and you want to have your shoulders in line, your hands in line with your shoulders. Take a step back, up onto your toes, and then lowering your body between your hands, and then coming back again. So we're working through the chest here. We're trying to build some upper body strength. I'll get you to come over to my position, and I'll line you up. So hands in line with shoulders, good. Just take them a tiny bit closer together. Try and relax through the shoulders as you do this push-up, up onto your toes. Okay, now do your push-up, so go forward and then come back. Excellent. I'll get you just to bring your elbows out to the side. Okay, go again. Well done. And just to that point. Go again. And stop right there. Perfect, go again. Fantastic, no pain in your shoulders or elbows? Wonderful. I'll get you to do one more for me. That's fantastic. Okay, so what we'll be doing here is we'll do 15 repetitions, and you'll do that twice in your program. I'll come and show you the seated row now. So what I've used is just a TheraBand. If you find that the band is a little bit too stretchy and you're not getting enough resistance, double it over. It also makes it harder to break by doing that. I'm using the bike now, but you can anchor this onto a railing at home, or if you've got a really sturdy table, you could use it around the legs. You're going to sit down. You'll have your legs out in front of you, shoulders back and down, and then you're bringing your arms towards your chest. Try and keep the elbows in and your shoulders down, and have a slight lean backwards. Okay, I'll get you to have a try. Okay, just bend your knees up a little bit. That's it. Sit up nice and tall. Excellent. And a slight lean back now. That's it. Perfect. Relax through your shoulders. Okay, now go. Pull back. Excellent. Well done. That's really, really good. So we're squeezing through the scapula. We're activating muscles through here called the rhomboids and the trapezius. Keep those elbows in nice and close. Well done. Make sure that you're bracing through your abdomen, and try and keep your shoulders as relaxed as possible. Now you'll be doing 15 of these, and you'll do 2 sets. That's fantastic, well done. Just do one more for me. Keep those elbows in, great. Okay, so the next exercise we'll be doing is a partial range squat. Now, being especially careful of the right knee, we're not using any weight for this exercise. I want you to imagine that you've got a chair behind you, and you have your arms out in front, and you're literally going to pretend like you're sitting down on the chair and then standing back up. I only want you to do the depth that is comfortable and where we can keep your technique spot on. So feet shoulder width apart, arms out, and then like we're about to sit back down on a chair and then stand back up again. Okay. As you're doing that, just pulling those shoulders back, that's it, and now sit back on the chair. Well done, come back up. Now you're not experiencing any pain in that right knee. Fantastic, you're actually getting great depth out of that. I'll get you to do 2 more for me. Try and relax through the shoulders, well done. Brace through your abdomen. Just drop your shoulders down. There we go, go again. Well done, that's fantastic. Good job, okay. What we're doing while we're standing up, and you can actually use the bar for a bit of stability. At home, what you can do is use the railing or a chair or a desk, and on one leg, you're going to do a standing calf raise. So you can use this for stability. Actually, we'll probably use the bike. The bike's a little bit more stable, so just one hand on the bike, up on your toe, and then back down again. And this is called a single leg calf raise. So I'll get you to come over here. Yep, we're going to do both sides. So start on the right side, lift up the left leg, that's it. Now push up onto your toe. Excellent, and come back down. Fantastic. Well done. And try and control that movement as much as possible. I'll get you to change sides so I can have a look at that. Just relax through the shoulders, brace your abdomen, try and center yourself. And go again, up onto your toe. That's really good. Do another one. Excellent, great. Okay, again, you'll do 15 each side and you'll do that twice. With these exercises, we're wanting to try and improve the muscles capability in an endurance type capacity. So we're doing more repetitions and slightly lower intensity. This program can also be done from home, which is fantastic. You don't need to have to be at the gym to do it. All right, with this next exercise, I'll demonstrate it first for you. So lying on your back, what you're going to do is drive through both heels, and you're going to come up and make a bridge and then come back down. Now as you go up, I want you to squeeze through your glutes and then keep your abdomen braced. Now if you find that that's a little bit easy, you can put one leg out straight and you can raise through one leg. But we'll see how you go with 2 legs first. Never lie down for me. Okay, so knees, feet on the ground, knees, both knees up. That's it, okay. So from here, what I want you to do is tilt your pelvis backwards so your back is nice and flat. Push your lower back against my hand. There you go, perfect. Now from here, I want you to drive your hips up so you're pushing through your heels and you're gonna make a bridge. Well done, and squeeze through your glutes as much as possible. Okay, come back down. I'll get you to do another one. Make sure your back is flat against my hand. Good. And now push back up. All the way up. Fantastic. All right, come back down. I'll get you to try one leg and see how you go. You need to try and keep your hips straight. Brace through your abdomen first. Think about the movement and then drive through your heels. Or heel rather. And lift that foot up off the ground and back down. So what we'll do is we'll keep doing the 2 feet on the ground and we'll work on that. So bring your leg back up. We'll do another 2 here. And once you've started to progress from this point, what we'll then do is start introducing the single leg raise. So 1 more. And this is something we'll work towards in future programs. Okay. From this position, what I'll get you to do is roll over onto your stomach, and we're doing what's called a bridge. Okay, so from this position, we're on our forearms. We're going to just push up onto our knees, just on the knees, not on your toes. That's it. Fantastic. Bring those hips up, squeeze through here. Try and squeeze your scapula together. Lift that side up. All right, and we're going to hold for as long as possible. So we'll hold for, at home, if you can try and hold for about 15 to 30 seconds. So I get you to rest, go back down. So see how you squeeze through your scapula now? That's what we've got to try and achieve when we're up in the bridge. So we'll do one more. Push up, 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 and squeeze. Good, excellent, well done. Okay, and hold for 5, 4, 3, 2, and relaxing. Well done, fantastic. All right, we'll go and do our cool down now. Okay. All right, Harold, we've finished the exercise program now, and we're just completing the last few minutes of our cool down. Remembering that in our cool down, we want to bring your heart rate down from an exercise heart rate back down to as close to a resting heart rate as possible. So we've only got a few more minutes here. I'll get you to keep cycling. But while we are here, I have a few questions to ask you just in relation to feedback on the session that we did. Earlier we identified in your pre-exercise screen that you've had the knee injury and that you've completed the rehab. We wanted to make sure that I've met your goals and that the exercises that we did for you were appropriate and nothing was painful. So do you feel that those goals were met?
Oh, I think so. I mean, still got a bit of work on them. But
Yeah.
yes, definitely.
And we've identified with the leg raise or the glute raise that we won't do the single leg, that we will actually change that and make that a double leg raise, and that we'll start working towards that. Do you think that that was reasonable?
Yes, I do. I think that's going to be a target that I have to aim for.
Excellent, and we'll try and achieve that by the next time we do our reassessment in 2 months' time. Did you enjoy yourself?
I did. Yes, and the knee's feeling quite good actually.
Excellent.
So that's not, wasn't too much pressure on it.
Wonderful. And how are you feeling yourself?
Good. Yes, really good.
Fantastic.
Yes, surprising.
Oh, good. Do you have any other feedback for me that I can go back and adjust your program? Is there anything that you'd like me to include for next time?
No, I think that's quite good. I haven't been on weights yet, but that's something I've got to build up on, try and work on that.
Yeah.
So that's the next step.
Absolutely, and what we'll be looking towards is in our next program, so again in about 2 months' time, we'll start getting you out onto the gym floor and we'll add in some more exercises for you that are a little bit more challenging.
Oh,
And hopefully your knee can take that pressure.
yes, sincerely hope so.
Excellent, that's wonderful. Well, thank you very much, Harold. We're almost finished here. What we're going to do is go and grab a really big drink of water and go and sit down and do some static stretching.
Great.
Thank you.
Thank